how's it going? My name is Tex. Today I'll be addressing sort of a second part or a follow-up question with the one that I did today, also on trauma. This one will be more specifically about some of the trauma therapies that are out there and helping you understand the terminology when you're actually seeking treatment for trauma. So you've had something occur that you might consider traumatic, or you have a therapist now who's doing something specific with you like anxiety or depression, and then you come to terms with the idea that you need to now move or shift into a trauma therapy. So the first thing to understand is some of the terminology. There's trauma informed care, and then there's specific trauma therapy. Now, trauma informed care is a way of understanding, and I like it when I was in nursing school, they discussed the idea that trauma informed care is basically what I consider to be trauma considerate. I don't know what you may have gone through in your life. So with that in mind, I have to sort of watch what I do so that I don't re-traumatize someone, or maybe I do know something happened and I don't want to re-traumatize you. And the way it was explained to me by an old nurse that had been around forever, she said that, when you go in there and you work in a nursing home, and in the mornings you're going to work with someone to get them prepared for the day and help them get dressed or bathe them. With any patient you ever work with, you always ask permission before you do anything. You ask permission before you touch them. You ask permission before you remove anything. So if, grandpa or grandma are sitting there and you need to pull the covers down to help them get their feet off the bed so that you can help them get on their pressure stockings, you let them know, Mr. Johnson or Ms. Johnson, is it okay if I pull the sheet down so that I can put your pressure stockings on? You don't just snatch the sheet off of them, because you don't know what they've been through and you don't know what's happened to them. See, this is about taking it in your mind, the proposition that since you don't know what's happened to them in the past, you don't know if they have trauma. So you treat them with the respect they're due, and with the idea that certain things you do may trigger the trauma. When it comes to therapy, a trauma informed approach may be that someone didn't specifically say or report a trauma that's happened, or you're dealing with, maybe, long-term depression or some anxiety. And then you're very sensitive to things that may be traumatic as they're brought up in therapy, because many times not everything is brought out in the initial intake. It starts to come out later when you're doing therapy with somebody. And so then you're very careful, as I call it, unpacking that suitcase. When I do an intake, I'm not doing trauma therapy, but when I do the intake, I come from a trauma informed and a trauma compassion type of stance, so that I explain to you, you don't have to give me specific details, and that's okay. I'll even say, it's not fair of me to make you unpack that suitcase full of things from the past totally and throw them on the floor for me to look at, and then expect you to pack that suitcase back up at the end of the hour when you're supposed to finish up, and then scoot you on out the door and go, okay, I've done your intakes, you should go away. That's just miserable. You don't do that to people. Okay. So it's the same way when you're dealing with anyone in therapy or in any type of, even personal relationships. When you have a friend and you're joking and you're laughing and you get in their bubble, if you will, you get close to them, you put your hand on their shoulder and they move away from that. Don't take it personal. It's not about you. It's about that person's feelings. And maybe they don't want that. And they shouldn't have to tell you why they don't want that. They just don't want it. See, now that's a basic dignity. That's a basic moral situation. When people say no, they mean no. And that includes, getting close, giving you a hug. I mean, demanding that someone give you a hug, and BS people. You don't know the person's situation, and they don't have to tell you, and you don't have a right to dig into their personal business. So let me get off that soapbox and go back into the trauma therapies. Now, leaving from trauma informed to specific trauma therapies. Okay, so trauma therapies, there's different types, and to me, it's like different speeds. And I always ask people, are you the kind of person when you go to the pool, do you like to just cannonball in on the deep end and get it over with? Or do you like to creep in from the shallow end a little bit at a time and get yourself in the water? The speed at which you want to do your therapy can also affect the decision of what kind of therapy you want to do. I'll explain that. There's one, most every therapist will do some type of CBT or at least be trained. It's an initial therapy that everybody has, cognitive behavioral therapy. Very good stuff, very effective for certain things that you're dealing with. Very effective, with basic anxiety and depression, even some cases, working with OCD. There's a lot of other things that CBT is very good at doing. In order to make that a viable trauma type of therapy, they have come up with trauma focused CBT. And trauma focused CBT, so TFCBT, is taking those skills that the therapist knows in the CBT realm and then bringing in trauma and helping a person learn first, just like with all types of therapy, calming skills to help a person calm down and basically, when things get upset, they get anxious, they're having a mood change, to be able to rein that in, and then slowly, ever so slowly, stepping them up with what they're exposed to as far as the situation. In other words, if the trauma is, got to do with a car wreck, then going through and working with your CBT skills, and then working with that person to help them be able to handle getting the car without having those trauma reactions of, intrusive thoughts and flashbacks and negative cognitions, and dealing with the situation so they can remain present. And you slowly build their skills with a level of success of handling the situation as they get better and better at parts of the situation till they can do the whole thing. Part that's incorporated in that with the one that I was taught is using a narrative focus. In other words, the person tells their trauma story, their trauma narrative. And in that way, either the child or the adult or whoever you're working with keeps their own journal or their art journal or whatever it is they're using to do their therapy. They're taking that and they're writing in it and they're telling their story. And as they tell their story, then they practice telling their story to you. And in the case of kids, there may be even a point where they want to tell their trauma story to their parent. Again, it's their trauma story, and they get to choose who they tell it to. And no one gets to demand that they get the story or that they hear it, or, it's that this is this idea that you're dealing with your trauma in a way you want by forcing you to tell your story to people you don't want to tell it to, or forcing you to tell it. You're re-traumatizing the person. See, and that's where that trauma informed part of what you're doing is. Forcing someone to do something re-traumatizes them. So now we take from that one, which is effective and it's at a certain pace. I also do EMDR, which is a bit faster paced. EMDR is eye movement desensitization and reprocessing. So it's a way of helping you take a trauma memory or situation and process it so that it becomes part of the system of things in your mind that you can use to deal with life instead of something that never got processed and just waits there. Both forms, the trauma focused CBT and the EMDR, they're both geared at, as many other trauma therapies are, of helping you process your trauma. Now, what does process your trauma means? It means taking it from that raw trauma memory that's never been put away and helping you organize it in your own mental landscape so that you can make it your story. And then once you've done that, you're able to use what happened and what went on and how you reacted to learn and change. No different than if you was, and I like to use the example of driving in the snow. If you're driving in the snow and you start to lose, your traction, you're starting to slide, you're taught to aim the front tires toward the area you're going and let off the brake. And as the tires start to gain traction, you can slowly start to, gain control of the car again, and then slow it down and stop the car. If you don't know how to do that, you yank your wheel the wrong direction and the way you want it to go instead of the way the car's going, because in your mind that's what you're thinking you should do, and you slam on the brakes and all kinds of things that's not effective. Sometimes when you have a slide in snow like that, if you can take what you did and realize it and then change it to where you now in your mind gain control of the process, then the next time you slide, you're able to remember what you're supposed to do and get back on track. You can pull that memory out and use it. And I love the example from Harry Potter, when they have the wand and they catch a memory and they pull it out and put it in a little bowl and they look at it. That's freaking awesome, because in my mind, that's what I see, is that you're pulling a memory out to use it. Okay. Now, the EMDR method is a little bit faster because after you've learned, and notice both of these, as with all trauma therapies, after you've learned basic coping skills, self-calming skills, anger or thought interruption techniques, then you start to do things to process. Now, the EMDR is a little bit faster and it's a little bit rougher ride for some people, and some people don't want that. That's all cool. It's your choice. It can be very effective. It can help you process the trauma and then help you move on. And a lot of times, regardless of which type of therapy you use, once you process one trauma, sometimes, not all the time, sometimes things break loose. And I call that the key log effect. And where I got that is somebody explained it to me that if you see a log jam, everything's, jammed up at the front, and that poor little guy that has to run out there, the logger, and unjam that one front log, if he can pop that, then the whole thing starts moving and all the logs start going down the river again. So several other traumatic events may process and fall into place and things start working for you. So that's two that I work with specifically. Now, sometimes people say, well, I'm not ready for trauma therapy, and that's cool. When you're ready, do it. Now, at some point, I feel it's best to drag things out into the light and deal with them. The thing is when. Again, that's a you thing. And sometimes you need help with skills. You take a little bit longer to learn the calming techniques. You take a little bit longer to learn those things. Maybe you need to build some self-confidence, some ideas that will allow you to deal with problems so that now you're ready to go in and do the trauma. Picking a therapist is also sometimes about picking their method, and one size does not fit all. A lot of therapists are very good about shaping their therapy to you, and they know 2 or 3 trauma treatments, and they try to work with you to find the one that's best for you. Just because you work with a therapist and they know one method and it doesn't work, please, as I always tell people, don't just quit. Maybe it just wasn't the right connection. Maybe you didn't have that therapeutic alliance you wanted. Maybe that form of therapy just wasn't doing it for you. And as you learn that, then you work with it another way, or you do something different. Sometimes, it's like a book. You pick a book and you're not ready to read it. You want to, but it's just not you. You put it back on the shelf and you come back later and then you go, okay, now it's clicking. Now I can read and understand this book. Now I understand what's going on. So if you watch my other video on getting a therapist, your therapist may be able to help you. And that's why I said all therapists should have no problem with referring you to a higher level of care or a different kind of care if it's out of their scope. So if you're working with somebody now who doesn't do trauma therapy, they should be able to help you. Oh, bad text, use that word. Hopefully they will direct you to someone who does trauma therapy. And then once you're through with the trauma therapy, you may want to go back and work with them on something different, or you may be done with your therapy altogether. That's for something that you and your therapist will talk over, and for sure you will figure out then whether or not that's good for you, whether you want to move on and do something different. So that's two examples of ways. There's another one that I've heard of, and I have colleagues that work with it, and it's called CPT, and I guess it's cognitive processing therapy. It's again a kind of way to do CBT and help people process traumas. From what I understand, it has to do with, making an impact statement and dealing with it, bit by bit. I'm not going to speak any more about it because that's out of my scope. I haven't been trained in it. I don't know the specifics. It does sound intriguing to me, and it does sound like it works very well for people who are cognitive based. Sometimes doing DBT, the dialectical behavior therapy, will help you gain skills that makes it very effective to do one of the other trauma therapies. And then you can shift right into EMDR or trauma focused CBT or a lot of other things after you've done your DBT. Some conditions need to be handled before you get into the trauma. Different therapists see it different ways. This is my way of seeing it. If you have a condition like BPD, borderline personality disorder, or some other condition that makes it so you become emotionally overwhelmed, then being able to handle that will allow you to do the trauma therapy. If you can't cope and you try to do the trauma therapy, it's overloading the system. And then you will get frustrated. You may quit. You may not want to do any therapy at all, or it may even become dangerous. So that's why any therapist worth their salt is not going to jump right into the trauma treatment. They're going to make sure that you have coping skills and a safety network and things to help you be able to handle your treatment. Safety first, always. So, hope you have a good day. If you have any questions, give me a holler call. I'd love to answer anything. If I can't, I will find someone who can. I will get you the answers, and I will definitely do whatever I can to help you. I hope you have a great day, and I'll be looking forward to hearing from you. Thanks.